Okay, the last tutorial was the simple one. This we left off before. Now this is called hypouricemic therapy. In other words, you're using drugs to lower. Hypo means to lower. So if the doctor's gonna try to lower your uric acid levels, they have to take these things into consideration. The number of acute attacks. So that could be, so if you've got a lot of acute attacks which is causing problems with you, like kidney stones and failure of the liver or acute gout attacks, then they'll say, look, we better give you some drugs to reduce it, hypouricemic. So what they look at is the serum uric acid levels, of uric acid, which the serum means in the blood, greater than 535 milliosmoles per litre or 9.0 milligrams per deciliter, right, which is litre. The patient's willingness to commit to a lifeline therapy. So the presence of uric acid stones, and we said over here, presence of uric acids in the kidneys, etc., etc., and uric acid stones in the joints, which we call gout. Now the other thing here is urate-lowering therapy should be initiated in any patient who already has chronic tophi, that is a chronic build-up of the stones, and gouty arthritis, right? Now, what are the chemicals or the drugs? Xanthine oxidase inhibitor, allopurinol, is the most commonly used, is the best drug to lower serum urate in overproducers. In other words, people produce a lot of urate. Urate stone formers, people produce a lot of stones, and also patients with renal disease. So you could just, want to fix up their kidneys because it's already got too much stuff in it. Now, we looked at this last time here, and this is the one that they talked about here, allopurinol. That actually reduces uric acid production. And so does this one here, febuxostat. This is another one, this one, pegloticase, that actually breaks down uric acid. That, you'd want to use that for sure. All right. And then these other drugs, colchicine is for inflammation, but I wouldn't use, you might as well use non-steroid anti-inflammatory drugs like ibuprofen, which I've been using for that. Now, so we looked at the acute effects of these. I mean, we looked at the effects of kidney stones in the joints, which we call arthritis, and in the kidneys, right? Now, but this is more important here. Hyperuricemia means high levels of uric acid, all right? And we said it's going to do gout, kidney stones, etc. This diagram here shows you that you can also produce uric acid from fructose, and this is the chemical pathway here. Fructose is broken up to fructose 1-phosphate, to hypoxanthine, xanthine, and then to fructose. So this yellow one is called hyper, means a lot, hyper above uricemia, and it has three devastating effects here. It's visceral obesity, hypertriglyceremia. The viscera are the body's organs. So it increases the lipids. That's what triglyceride is, another name for a lipid, right? We won't get too technical. So basically you're getting in here lipids or fats developing on the viscera. The viscera are your internal organs, your kidneys, your liver. You say, oh, you've got a fatty liver. It means the surface of it, So you're building up fat on top of the organs, which isn't good. Now, the other one here in purple is called inflammation of the endothelial dysfunction, hypertension. Hypertension means increasing blood pressure. What do they mean by inflammation of the endothelium? If we just talk about the different types of endothelium, well, one of the endotheliums, well, lots of it, is, let's look at the blood vessels, right? The lining of the blood vessel, that top layer is called endothelium. Now, you can build up cholesterol in there, and it will start to make the endothelial make it constricted, make it smaller, right? And the other thing that it could do it is it can get inflamed, inflammation, it builds up inside fluids, etc. So in other words, the lumen of the blood vessel is reduced. The lumen means the hole. In other words, it becomes constricted. If it's dilated, it's good because blood flows in there reasonably good. It hasn't got, but when you constrict it, in other words, you make it smaller and smaller, right? You increase the resistance to blood flow, and resisting to blood flow causes increased blood pressure. So that's this part there, increases blood pressure. That's how I explain that. The third one, which is very important too, is the diabetic part it affects. The insulin resistance. So having high uric acid levels, hyperuricemia, results into insulin resistance. Hyperinsulinemia, that means you've got too much insulin, and that causes insulin resistance. And hyperglycemia, that means high levels of glycogen in the body. So all those three things produce diabetes.